Damasi.
Administrator Madam Roma say kwan bo make my first record wa na aya my record am I.
Yeah.
First time so I shall clear record.
I'm recording.
Yo.
But Obi am mute.
Okay, me damasi bebre mamu nyina yonkodo. I'm very glad say ene me ba na ebe kasafa eni no kakra. Na me ankasa na from me Dr. Caleb, I'm a optometrist, eye specialist. Inti ene pese some concept ni me bi e fa eni ne ho. Eni ni me bi e ya ye nim se ebe ha yen daachi, but ehu ne se mfumso bi eni ho. Inti na me hwe nyina se at the end of the day no ene bi won mana yen tiase a enko se be wie no na nyina yenye emuhumu na nkofa eni ehun sem bi ambrain the massive bebre. All right, now topic number 2 din say how to take care of the eye and visual concepts in any kind can be never so boy in ho ban and in some in ben what any ho a yen che dan ti ase even though yet but emuhumu no it is the same. So be looking at all these concepts. All right, now without wasting my time, I didn't say we are constantly being bombarded with magazines in near fa health home and your skin comment of a skin no hair even though it will be in our feet, diabetes, cancer, they are all perfect. But at the end say your my feet say a so is very much important because what may be sound say fit our best or pa everything you do is about the eye. Everything you do is about vision. So when vision becomes problematic or when you being able to see becomes difficult, your whole life will be impaired. There are a lot of times people about eye clinic. Omunya nkombe 7,000, 10,000 of cities just to restore their eye. But what I'm say they wait for too long. Inti ombebano na too late, nothing can be done. Mamfe wentwem kakra na mo abetifi eye clinic ana man bi eba honum na man say or cars na dia na ontimi and drive because they need baako asay ana baako nso essay na eba na sa no person ka okune ho because ontimi ntina wi ase a wonhu ade inti ye okase na ye bi surgery sembam so eni enko surgery be bo na ana so me de menya kra na say 100 million kra na mbeje a obetwia na we. I mean, so sad. Meanwhile, also, I'll be a course sano. Thank you, when ya. Casan may name to me course. And so what's now what the future a buyer no, not a gentleman. And Qualabe bring now so most school on performance no, and it's a collab when it's only my deal. Now, our vision problem. But one thing is, so, Osa, own to me, man, cast say, and I say, a yame. And our monos mostly, say, a dear muhuno. Son, I was on Inti akwala bitimi betima tro no tro fa ha no ntro mfa la enim ene ne keka ho bodwen sa akwala na ntie wu ente sa inti senka kamen kwa before say akwala bia be ko school no. It is very much important that this child should be taken to an eye specialist. Nya hwe ne ninimu nya hwe ne nini ho yam say asem bi ni ho before the child can proceed. For instance, we on kwandu KG2 na fa ne bra nya says no say asem bi ni ho a they will proceed because baby now vision problems are bedu say oni ma de nanso na entisa inti. To cut a long story short, you be hwe ne bi afa anini ho kakra na hwe ekwan a you so ayi ho afiri ho an kofa a how bia mre en dachi damasi bebre. Now the very first one I make ho asem no your friend myokemia and yare we a friend myokemia ana eyelid twitching. One, what's a hono mo na se wani achi no e woso ebi nso de omani ase e woso o hono ma na aba o hono ma na ekọ And that because meaning say most of the population. Most of the population. Please mute yourself for me. Most of the population.
Doctor, just mute everybody. You can
Right.
mute everyone. No, not, just mute them.
Okay, but your Mutimenka. Me da si bebre. Inti me se first concept and our first thing e be kasa fa ho no e friend of myokemia. Na sa myokemia yi me the ban in simple terms mu a patch say eyelid twitching. Obi te ho no ma o ho an na nyachi woso e sheki. E bi nso de o mani na se e na sheki. It happen most in the populations. People nice experience had no. Now it becomes a problem because on Cynthia or say a bansa. Inti me a video be on this eyelid twitching. Yen kohe near and ye may be a desahaba. Inti that be what now we experience that kind of problem. Then you know what to do to refrain from that action. So let's look at video on my leukemia. I want to honor more. Now when you know, was also now when you know, was also. So this is the leukemia. Inti video ya yehui eye obi a always experience this kind of eyelid twitching. Obon ma ne ni ase bu so hu ani aso. Na ndi ntia me nyina ba no se etoda ye ne mebi ene ma sa de ne ba mostly no enye yare bi ene de ba. It becomes serious say long standing na ana ebe problem. But mostly no aya enye long standing eba na ekọ ehwa na aba. Nampacho yenti we ni channel so because ha nema we na deba. And say we experience here, then you get to know the causes. Inti ade bia o ya do ba wi nsa no so oh ebia oh nansi me nantem nansi bia me bre inti ne bia ade ye me say any moment me bre so. Inti common causes of this myokemia eyelid twitching stress, lack of sleep, inti men na dehydration, onum nso. So otherwise all these things will come about. Over caffeine too much, depression, anxiety, magnesium deficiency. Inti also utimini in rania a lot of magnesium. I feel so obre etim this high weba. Untime so na ana one nanta one son etime deba. Unum so be brea etim deba. Inti neme patching and said this very first one myokemia no. When you refrain from all these things, it results in that. So if you're not able, if you go to stress, if you're not able to sleep very well and all that, you experience this. And to the point I want to emphasize here and say, whenever you're experiencing this eyelid twitching, myokemia, go back to the causes. And if you're say obre etim deba, unantem etim deba, udantem sorentem, etim deba, unum so be brave, etim deba caffeine, depression, anxiety, and magnesium. Whenever you're experiencing this kind of problem, get to know the causes and refrain from any of them you are acting. Thank you very much. Now, the next one I would like to talk about is do not rub your eyes. It becomes, I think it's a norm that will be simple. We just take a hand or rub it. Even if you just say, before say what they want, I was say, oh, sansa. Inti yam fire sasa enko yeni sakeke dabi. Inti na me pache and say do not rub your eyes. See when ke kaw and when ke kaw yen min kind of saying yen posa, because it will result in serious eye conditions. Maybe you wouldn't be expecting. It's message say yen ma yen posa yeni. See when ke kaw and when ke kaw yen posa. Nemum you need to go through the appropriate procedures. Say allergic reaction at the bar. Make sure you get your anti-allergic drug. a draw and an also way. But so when you can now passade myself, a free neque, as some say, any sabium, because a result in dangerous conditions be make a once see. Now, effect of rubbing the eye. Though it may seem harmless, rubbing your eyes is something many of us do from time to time. May person many am when from so be any home. People now so from time to time. Now, doing so feels good because it seems relieving. Yes, because when you come in and posa, at least it feels relieving. But there are much danger aside to that. You see, the more you rub, the more the eye becomes itchy. My ear feet say any kind of a rubber. Me who say the more na ye rubber no more na any kain because any crass cells and I body crass cells be a mass cells releasing this kind of chemical mediators. Now, sanima way no and air cause itching. For instance, if it is allergy and air causes are internal semicassin may rob many come me robia more na may robber no more na meaning so back coming. We are once high, but the point I even want to establish and say, more my young posaya ni sending poke kaya yempe appropriate ways no. Say they drew a buffer a drew a bit me a boy and I see via home remedies. Ebia cold water, my cold compress. It's much share send a bear cold compress in send a bear uncle for how being brain. Now yempe in soon swear the bar one. Semi person person mania in soon swear to me the bar first. Kratoconus. Where or how about qua and niposa be breathing me the bar. But nipe brain so any away. Until today, now I want us to be very much aware about this kind of condition. Keratoconus. What is keratoconus? Keratoconus here. Now you hear now, you know. I hear just so. Now on a mere observation, you should say, oh, I did it to no. But you are deep that's what I heard. I will focus on your friend cornea. Now, so me try some me posamania, the more I itch, more now me posamino. It make it this cornea very weak. Into very normal cornea. Very weak. And very thin. Manium red. Into Sabana Sana. A push it forward into very normal cornea. Let me the pointer. We add the normal cornea. Normal cornea. Mini shape no round come on. Now me put some no. Fair and action about any moon say. When so any keratoconus nibi and also action about any moon. Keratoconus is unya. I say cornea transplants. I see ye near transplant amount. It will be the ashama. Ain't I don't know me refraining from all this kind of actions. Now a deep and preventable. At a point in time, I see here will be cornea near try the better media insurance. Even the amount of money you pay to get this done is even something else. Intimate so me who say you're possibly be brain it could result in keratoconus. And a keratoconus na my children may say normal cornea ni na unya keratoconus na a brain baby into a chimba any moon say a banner vision the way who had ye ever say into one young we draw the more lenses so wow. I say do save you cornea transplants na kuyi into fresh amount. It's a say me who say ya puni posa baako so de ba e keratoconus woni na de da so no e be pushi aba ni mu nti ba na sa e be difficult to see very well. At the same time ba in treatment so a ubehia surgery enye surgery bia keke than cornea transplant. Very important, right? Now the next one I'll talk about rubbing the eye. Eye rubbing can cause acute IOP elevations up to 310 millimeters of mercury above baseline as well as keratoconus. It's maka keratoconus. Now, who say eye rubbing may posa panino a bit me jamming Arabia feno glaucoma. I know say most of us are glaucoma. It's any posa be braino a cause glaucoma. Ne kwan so and a cause glaucoma. Before that, glaucoma no cry then. Glaucoma ya near Arabia affect ye nichi ntino and may need to take to at the point I bear blind. Enti glaucoma ebetimi amoni eden efra. Enti eye rubbing increase IOP. IOP ni eden. IOP intraocular pressure, eye pressure. Senior systemic pressure. So mko checking pressure and pressure na was a form no. I need also a pressure ni bisa. Then na friend no IOP, intraocular pressure. Now sa intraocular pressure no, the normal pressure that is supposed to be in the eye, from 10 to 21 millimeters of mercury. 10 to 21 millimeters of mercury. That is the normal pressure that needs to be in the eye. Anything above that can result in glaucoma. And glaucoma, much as say a near ABI affected when you're in now at the point in time, no, wait may develop blindness. Now, you say, oh, Robbie, when it can elevate it up to about 310 millimeters of mercury, even though the normal one requires saying 10 to 21. By eye rubbing can increase it to about 310, which is much dangerous. Very, very dangerous. And this is the glaucoma I'm talking about. We know. And take out Oko Eye Hospital, I can see a check you when you're chia. Sign him in a year. Sign him in a year. Now, Obia or glaucoma. Who are they saying? Initial state of glaucoma, so we want there. Baby, I clear, normal vision. Or how be no. Very clear. Nippana started being a glaucoma at the early stage of the condition, no. It won't say vision, no, and hono, edundum. Vision, hono, edundum. I extreme glaucoma, won't say in no, a cocra. We are advanced glaucoma, won't say we are advanced glaucoma, and we are extreme glaucoma. Until at a point in time, no, won't so vision in a bedum, not be blind. And see, what you say? I rubbing no, and then the person here did a problem. But over time, no, a mind conditions be a yeah, do my answer. With a banner same many dear, be beyond Conhunia, be beyond more certain requests, but in your man kissing in United to make also. Right. In Tienve, nay refraining from the eye rubbing because it could result in what? Keratoconus. A more in a push any moon, a year when that's no. A basam so here cornea transplant. A bit is also glaucoma because it can increase eye pressure. And eye pressure also a risk factor for getting glaucoma. Even when you're chinting at it. It can when you can but at the end of the day, you know, look at all these. And to master say we will stop, we refrain from eye rubbing. Now, rubbing your eyes, we'll see another one. Rubbing your eyes may cause tiny blood vessels to break, resulting in bloodshot eyes or dark under eye circles. Now, when you know our blood vessels, when now now, as one thing I say, the more you itch, no, look at how we eat extensively, how you rub the eye extensively, it is going to break this kind of vessels. Now, for a livy a year, muja between adaso, now also all this kind of thing. To see this one seems to disrupt appearance. Okay, we know ancient how vishy, but a bit affect our appearance because this kind of underlying blood vessels to burst open and then release some kind of blood into the pipe of the eye, which is much dangerous. This is also caused by eye rubbing. So please let's refrain from eye rubbing because may person you know but at the end of the day, no, but you find a normal say from so be any home. Right. Now, another one. Over time, chronic eye rubbing causes micro scratches on the cornea, and those small scratches accumulate to cause serious damage. Share me posa menino, me inform any who me won scratches for you. Me inform any who na me posa menino, won't say it just scratches. Oh, menino so. The cornea also is a very sensitive part of the body. When there are scratches, you feel it will be irritating. Now, when you so ever prove so, and it can even accumulate certain material and even cause damage. Many can but at the end of the day, look at all these conditions that I'm going to experience. Scratches on the cornea. I'm also going to experience break of my vessels on the eye. Glaucoma. glaucoma bit fra, but rubbing the eye no any direct effect. Rubbing the eye no ebe cause or eye pressure no akosoro. Now eye pressure no kosoro ene ekoma iwoni chintin atete. That is glaucoma. Me person many keke. And so at the end of the day, look at all what is going to cause. Now, Ms. also can say it can cause keratoconus. When in a or robbing a baby week, now when I then appreciate any moon, addition to the structure, now for ever cause a whole lot of problem. Patrol time in university in minutes, and she said, a sope, a back at it, then we come back again. Again, it might stop very soon, but stop here, best I'm back for the next session. All right. Refraining from any eye person. Now, the next one I'll talk about is toxoscar. Mijidi say, Yawe and Nampa meat.